Hello, and welcome to the Osteoarthritis Action Alliance Lunch and Learn webinar for November 16th, 2022. Thank you for joining us this month. Our presenter today is Julie Coleman. Julie is currently working with the Osteoarthritis Action Alliance through the CDC's Public Health Associate Program. She is a graduate of the Pennsylvania State University from the College of Health and Human Development. She earned a bachelor's degree in Biobehavioral Health, in which she studied comprehensive approaches to understanding the interactions among biological, environmental, psychological, and sociocultural theories as they relate to human health. The title of her presentation today is Introduction to Arthritis Management Programs. Welcome, Julie.
Hi, everyone, and hi, Katie. Thank you so much for having me. I'm delighted to be here today and presenting for November's Lunch and Learn. I just want to give a quick shout out to the Osteoarthritis Action Alliance for giving me the opportunity to speak today with you all. And Katie, thanks for the introduction. With that, we will get into it. As Katie mentioned, today we're going to be doing an overview of arthritis management programs. So I'll just start with giving a quick overview of the presentation. First, we're going to briefly introduce arthritis and osteoarthritis for those who may not be as familiar with the diseases. After that, we will dive into what an arthritis management program is and work to understand what it means for a program to be evidence-based. With that, I will talk a little bit about what the program evaluation process looks like. Then I will hope to be able to teach you a little bit more about what programs can do for you and why you might want to join one. And finally, I will introduce the arthritis management programs that are available and do that on a broad scale to give some extra resources for you all in case you'd like to learn more. So we'll start with what is osteoarthritis or arthritis. Arthritis, in a nutshell, is the swelling and tenderness of one or more of the joints. And that's sort of a simple definition, but with that, arthritis is sort of an umbrella term, meaning that it encompasses a couple of different types of that joint swelling and tenderness, which is where osteoarthritis comes in. So osteoarthritis is a type of arthritis that specifically affects cartilage. And basically in osteoarthritis, the surface layer of cartilage breaks down and wears away, meaning that the bones under the cartilage are able to rub together. And altogether, this breakdown of cartilage causes the common OA symptoms of pain, swelling, and loss of motion. And if you look to the right here, you can see that these symptoms may be experienced in any of these places, so the neck, shoulder, hands, back, hip, knee, or foot. A little bit more about osteoarthritis is that it is the most common type of arthritis, affecting over 32.5 million Americans. So that is actually 1 in every 7 American adults who have osteoarthritis. And unfortunately, these rates are expected to increase. But of course, there are many ways to take action against osteoarthritis. I think something that people don't always understand about osteoarthritis is that even though there is no cure, it can actually be prevented and managed very effectively with the right help and the right tools. So for example, managing your weight with a healthy diet and a physical activity regimen can help to reduce joint pain significantly. And people who are able to maintain a healthy diet or healthy weight are actually less likely to develop knee OA. Another example is self-management education, which encompasses programs or initiatives that help teach people who have ongoing health conditions, such as osteoarthritis, to live life to the fullest. They are clinically proven to reduce symptoms of osteoarthritis and improve quality of life. Another way to prevent and manage osteoarthritis is by staying physically active. So working to become physically active can actually help reduce pain if it is properly done and if it's safely done. And there are many types of arthritis-friendly exercises, including walking, water exercise, yoga, stretching, and more. And finally, something that's very important with osteoarthritis is the idea of injury prevention, because having a joint injury is actually one of the ways that osteoarthritis can develop. For example, Individuals with a history of knee injury are 3 to 6 times more likely to develop knee OA. So injury prevention, such as neuromuscular training exercises, can reduce the risk of traumatic knee injury by up to 80%. So it's important to know that there are these management and prevention strategies that individuals can engage in to help with OA symptoms. And that's the really wonderful thing about these management and prevention strategies. The other thing that's really great about them is that the 4 strategies sort of feed into one another. So if you engage in one, it's much easier to engage in another, and then you'll be even better off when working towards a greater state of well-being. The final thing that I want to talk about here are treatment options. If you are already somebody who has developed OA and you're looking for treatment options, there are many different roads that you can go down. Like I said before, there is no cure for osteoarthritis, but at this point, there are many things that people can do to help ease their symptoms. And some of those encompass those management and prevention strategies that we talked about a minute ago. You may have also heard about some methods like corticosteroid injections, joint replacement, or prescription medications to treat symptoms, but many of these examples simply mask the symptoms and can be costly or burdensome. And they don't always address your ability to prevent and manage osteoarthritis, like we were just discussing. So that's why I'm going to introduce to you today what is a really wonderful way to address arthritis. And this is those arthritis management programs. So what is an arthritis management program? It is a plan of action that can help individuals manage arthritis, whether that be to help with managing pain, increasing mobility and activity levels in daily life, or simply educating on what it means to have arthritis and how to continue moving forward with your diagnosis or the possible development of arthritis. So there are a few different types of arthritis management programs, including but not limited to self-management education programs, which are kind of like educational courses, and physical activity programs, which encompass many different exercise programs. And then there are some programs that are a combination of both of these things. The next thing we might be thinking about is what makes something an arthritis management program. And so by our criteria at the Osteoarthritis Action Alliance and in collaboration with the CDC, for something to be considered an arthritis management program, it must be evidence-based and arthritis appropriate, meaning that it must actually address arthritis and it must help to manage arthritis symptoms, which is why we also refer to them sometimes as arthritis-appropriate evidence-based interventions, or AAEBIs. For a program to meet this criteria, it must also be ready to be implemented so that individuals like yourselves can actually take advantage of it. Now you might be thinking to yourself, how do you determine what is arthritis appropriate or what is evidence-based? So we have a review process that we go through with our programs to make sure that they meet a certain level of criteria. So since 2021, the Osteoarthritis Action Alliance has conducted a review process that looks over arthritis management programs out in the field. And with the help of arthritis-involved professionals, we're able to approve new programs that fit into an established criteria and guarantee evidence-based practices. Some things that we ask for in this review process are that the program must include a research study that includes about 75 individuals or more receiving the intervention or taking part in the program. The study must be published in a peer-reviewed journal article, which basically helps to ensure that the research is valid. There must be appropriate measurements taken for the study. So there must be some sort of testing done or survey taken before and after the program and it is administered so that it can be reasonably concluded that there was some sort of effective change. So moving on to that second bullet, because we are an arthritis-concerned organization, we need these programs to be relevant to arthritis, and that includes having statistically significant changes in at least 2 arthritis-relevant outcomes. So that might be a reduction in pain or fatigue, or an increase in mobility, that sort of thing. And there are a few other criteria, but the last thing to note here is that all of these considerations together should be objective and balanced, and overall they should improve arthritis-relevant outcomes for individuals. The data needs to be sound and proven to be effective, and when all of that is true, we can conclude that the programs are evidence-based. So that is what makes a program an arthritis management program or an arthritis-appropriate evidence-based intervention. So another really great question to ask is, what can these arthritis management programs do for you? Not only can arthritis management programs improve arthritis symptoms, but they can also provide an opportunity for individuals to take control of their health and well-being and continue to stay active. So let's get into the nitty-gritty of what they can specifically do to help. They can perhaps most importantly give the opportunity to learn pain coping skills through many different avenues. And I say that this is important because pain is often reported as one of the most draining and prevalent symptoms of arthritis. And not only can these arthritis management programs improve arthritis symptoms of pain, but they also provide benefits. And just so you know, I'm pulling these directly from the program descriptions, like learning how to overcome barriers and set goals for health, creating greater awareness and control of one's body and space, and overall just giving longer-term health lifestyle behaviors that can help individuals feel as though they have more autonomy and more control over their well-being. Another really wonderful thing about arthritis management programs is that they don't only target arthritis, they can also address other chronic diseases, excuse me. Since arthritis is unfortunately a common disease, as we discussed earlier, it is often comorbid, meaning that it also occurs at the same time as many other chronic illnesses. This can include obesity, depression, chronic fatigue, and many other diseases or illnesses. But arthritis management programs are often broader than the scope of just arthritis and are able to address larger symptoms. So taking part in an arthritis management program might help to relieve arthritis symptoms, but it can also have a ripple effect on your overall health and can address other chronic illnesses as well. So I just want to give a brief look at the arthritis management programs in their entirety that we have at the moment. I know this can be a little bit overwhelming to see all at once, but it is easily broken down, and I hope that we can illustrate here that we have many evidence-based programs that you could take part in, and because we have so many options, hopefully there's something that might interest every person in a distinct or individual way. And you can see that they're divided here into physical activity programs and self-management programs. So next we will go into those two different types. So we'll start with physical activity programs, which are designed to help increase an individual's physical activity in a safe and manageable way. They may help to reduce pain and can improve function, mood, and quality of life. And the benefits across all of our physical activities programs include an improved range of motion, stability, and balance, an overall positive effect on an individual's sense of well-being and their confidence in their ability to exercise, increased muscular strength and joint function, and of course, a reduction in arthritis-related joint pain and stiffness. And these physical activity programs are offered in many different modes and settings. So just as a few examples, we have an aquatic program, so water aerobics. We have Tai Chi and Tai Chi Quan programs, which are characterized as fluid, gentle, and therapeutic movements. We have walking programs, and then we have those standard fitness classes that can be adapted to each person's physical ability. So that can be a sitting mode or just creating a different low impact modification or other considerations. And across the spectrum of programs that we have, there will be an offering for you depending on your comfort level. If you'd feel better taking a class in person and having a face-to-face interaction, we have a program for you. If you would prefer a at-home Zoom class, there's an option for that as well. And maybe you prefer to go at your own pace and do it on your own. Whatever it may be, our programs span a wide range of offerings, so we will have something that can cater to you. Next, we'll go into our self-management education programs, which are designed to teach individuals about how to cope with symptoms, handle stress, manage fatigue, and live active and fulfilling lives. So the benefits across the self-management programs that we offer include improved exercise and eating behaviors, reduction in fatigue and pain, a decrease in feelings of social isolation and depression, and a reported improvement in life satisfaction. And the self-management programs also have many different modes and settings. There are entirely virtual or toolkit-based self-directed modes so that you can learn at your own pace. There are in-person and virtual group workshops, so you have the opportunity to interact with others and learn from one another. And there are in-person one-on-one or virtual one-on-one modes, so you can have more of a personalized experience. And finally, I want to mention that there are some programs that have a mix between self-management education and physical activity. So you're kind of getting the best of both worlds, benefits from each of those categories that I just explained. And those are offered in many different settings in many different ways as well, including virtual and in person. So the last bit of information I have for you is just that you might be able to want to go one step further. So if you're a little bit interested or a lot interested, you can feel free to get engaged with a program and check out our website at the OA Action Alliance, which has more information about each of these programs and how you can sign up for some of them. So that's this first link you'll see here, oaaction.unc.edu/AEBI for more information. And then you can also look in your community and see if there are any programs available and you can start at places like community centers, faith centers, YMCAs, and area agencies on aging. And then I have some other individual links where you can learn more about arthritis and osteoarthritis. And that brings us to the end of the presentation. Thank you all so much for listening.
I think for especially those of us kind of in the details of AAEBIs and arthritis. Thank you, Julie, for that great presentation. Really appreciate you breaking it down for us and helping us kind of understand these arthritis management programs from a broader perspective. I think sometimes we get caught up in some of the technical language, and so really appreciate how you describe these programs. If anyone has a question for Julie, feel free to type it in the chat. I also wanted to let you know Julie did have some great resources on a previous slide, and we will share those with everyone in the follow-up email. She has them listed here, but we'll also include the links in the email where we send out the recording. So it looks like we have a question here. Julie, do you know, are there any programs specifically for erosive osteoarthritis of the hand?
I am not entirely familiar with that type of arthritis. We, to my knowledge, do not have a lot of programs that work on fine motor skills, but I know that some of our exercise programs do a range of motions. So it's possible you might be able to find something within our lexicon of programs, but to my knowledge, there's not specifically something for hand OA.
Great. Thank you, Julie. I had a question. I wondered if you could say a little more about what some of the remote programs might offer in terms of format or resources.
Yeah, absolutely. So, with COVID and all of the things we've experienced in the last 2 years, obviously there were a lot of not very positive things that came out of that. But one of the great things that I think we've all learned is a way to sort of connect with each other and engage with certain programs and certain things in new and novel ways, right? So one of the really great things that came out of that was a lot of different ways to engage with these arthritis management programs. And that includes virtual Zoom formats. So some programs you can take an exercise program over a Zoom format. Some of them are phone call based. So if you're not very comfortable with, more integrative technology, you can do sort of an easier phone call, and that can be scheduled and done on your own time. Some of those offerings for individual learning are at self-paced, so you'll get either a booklet or you can do an online program that is completely on your own time, and you can complete that in whenever you're comfortable, and you can take as much time or as little time as you would like to with it. But there are lots of different options. So even within sort of that virtual setting, there are lots of different things you can do. It doesn't have to be computer-based. There are some that have booklets as well. So there's sort of a large offering of different options that might work for each individual. And again, there is some more information about which program offers which setting on the AAEBI website. So on this slide, the first link here, and there's actually a table on those pages that will tell you exactly what modes are offered for which programs.
Thank you, Julie. And since there are so many options, I can imagine it might be overwhelming for someone who's not as familiar with the programs. How would you recommend that somebody figure out what program is right for them?
Yeah, so first of all, I would recommend going through the Osteoarthritis Action Alliance's web pages about living with arthritis. So you can kind of see where you fit in on the spectrum of having arthritis or possibly developing arthritis. And then you can kind of categorize what might work best for you. If you're interested in being in an exercise program, there are tons of different offerings for you. So if you're more interested in something like that, a sort of slower movement or a more integrated practice, we have options for you. And again, you can go on those Osteoarthritis Action Alliance AAEBI pages to read descriptions of each of these interventions to get to know each of them a little bit more. And so that would be my second recommendation, is after you've sort of pinned down what you might want to do, maybe you don't want to go right into physical activity. Maybe you'd like to learn a little bit more about osteoarthritis or chronic illness, or what it's like to live a life with these sort of ailments, right? First of all, you can go on to those pages and you can sort of click through and see what mode works for you and see what program might best fit what you are interested in. I hope that sort of helps to answer your question, Katie.
Yeah, that's helpful. Thank you for breaking that down. So the OA Action Alliance website is a great resource. I put in the chat the individual page. It kind of has lots of information about staying active, weight management, all the different types of treatment options, and links to other resources on our page. And again, we will include these links in the follow-up email. We do have a question, Julie, along those lines. Do you have any information on non-surgical options in lieu of knee replacement surgery?
Yeah, so we do have resources. Again, I'm just going to keep plugging the Osteoarthritis Action Alliance pages. We have lots of different options, but the arthritis management programs are actually considered to be a form of treatment. And so that's something you might be able to do in lieu of a replacement surgery. Obviously, if it gets to a certain point where you're experiencing a large amount of pain and it's beyond your control, you may have to go through that avenue. But I will defer to the resources we have on the osteoarthritis page that can speak better to this than I can. You might be able to learn a little bit more on there, and yeah.
Great, thank you, Julie. We have a question here. Why is OA not considered a disability?
I'm not sure I'm actually the appropriate person to answer that question. I would be happy to take down your information though and try to get you in contact with someone who could answer that question.
That's a great point, Julie. And I will say osteoarthritis is a condition that does cause great disability. And so it's in fact, it contributes to some of the highest number of years lived with disabilities in people who do have osteoarthritis. But we would be happy to take your question offline. Carol, if you have more questions, we'll get with our advisors, our research and medical advisors, and get some more information for you.
Yeah, thank you, Katie.
All right, well, I don't see any other questions in the chat. So thank you all very much for joining us. And Julie, thank you for the presentation today. We hope you can join us next month on December 14th for a presentation by Serena Wiesner and Marvin Albert Meza-Harkin, who will present evidence-based programming for Latinos with arthritis, current findings and next steps. Thank you, everyone, and have a great day.
Thank you.